Our next topic is from Dr. Mark Hohenberg from the School of Medicine, and the presentation topic is what we need as we get older, perceptions from elders and healthcare staff in the Macarthur region of Sydney. Thanks very much, Mark.
Thank you. So good afternoon, everybody. Thanks for joining us today. One irrefutable fact that I have to say is that we're all going to be a bit older at the end of this 5-minute talk, and that's a bit about what we're talking about today. I'm talking a bit about aged care in the southwest of Sydney. So we have an ageing population here in Australia, one that's very pertinent to many of us, and indeed many of us around this audience, between 30 and 50% may have people who have aged care requirements getting older. And as you can see from this graph here, this represents some of the dementia prevalence rates, and they're increasing across Sydney, and particularly affecting the southwest. And we've got the 3 suburbs that are going to have the highest increase of the prevalence of dementia by 2050 in Campbelltown, Macquarie Fields and Camden, representing a 468% increase. And indeed there's going to be a 48% increase in the elders population in the southwest of Sydney by 2021. So this is a big problem for us. How is healthcare delivered to this age group though? It is a fragmented aspect of healthcare. So the hospital will be doing one thing, GPs will be doing another thing. The federal and state budgets fund different areas of healthcare, which make it very difficult for us to access and deliver effective preventative measures, which hampers healthcare for the seniors. But the seniors often are a very quiet voice. They don't tell us what they want and what they need for healthcare. And that's what our study was aiming to address here. Our team, we wanted to go out and ask the very people we're aiming to serve, to try and ask them what is important for them as they get older, what healthcare do they need, what other services, social problems do they have, and we went out to explore exactly that. We asked nearly 1,500 residents of nursing homes across 3 nursing homes. They were represented by the aged care staff there. We asked 59 GPs, and that was nearly 700 patients that they represented on a daily basis. And we also asked a series of patient and carer representative groups, and we had about 59 of them come into attend focus groups. And we asked them what are the problems in the region, and they told us. And some of the results were not so surprising, some of them were very surprising. They told us there were transport problems in the southwest, accessing specialists, a huge burden of dementia and delirium in the local populations, a lot more than perhaps we'd suspected, but certainly we see elements of this in Campbelltown Hospital, one of the major hospitals in this region. So they were also telling us about the burden of social isolation and some of the stigma associated with dementia and the other conditions here, things that we don't necessarily focus upon so much by way of education from the healthcare service. So what did we do with this information, and what was the general impact of this? Well, it was multifactorial, first of all. There's some things that we have achieved in the process of achieving, and some things that we're working towards at the moment. Firstly, it's brought together a number of groups, and you can see the groups, some of the groups that we worked with this initial pilot study on the bottom there. And the impact of the research has brought these groups together. We're now working together. No longer are we working in silos where some of the nursing homes will be doing their own projects, but we're working in tandem with each other, with the hospital, with the health service, the local health district, and we're trying to build some leadership and a vision for aged care for our local region, which hasn't been done to the scale that we're achieving with this now. Some of the nursing homes are attending the aged care network meetings, so we're having a coordinated approach to aged care across nursing homes between different facilities. We're also seeing a development of a community geriatric service at Campbelltown Hospital that I'm leading the development of, that is focused towards delivering healthcare for what our elders have told us that they want. Podiatry, for example, access to specialists, being able to see an aged care specialist for a diagnosis of dementia and linking that in to the services already existing in the region, which are fragmented otherwise. And the primary healthcare network at the bottom there on the left-hand side are assisting us with this for dissemination of this information to the general practitioners. On top of that as well, we're changing this culture of how we deliver the healthcare. And this is a process that usually takes time, but we're already seeing this in place now, where people are coming to us as the group leading this at Western Sydney University and Campbelltown Hospital, asking what do we need to do. Indeed, our team have been over in China in the last week explaining about how we've been developing a community geriatric service here and implementing this effectively. So the Chinese have been very interested in this. And the media, as you can see on the right-hand side of the slide, they have been very interested in one of the spin-off projects from this. There have been 2. The first one has been a larger scale study where we're going to be doing the same research study but across all 7 local government regions. So we actually have a true representation of what is going on in the Southwest as opposed to the Macarthur. And then the final aspect is what we think is the Australian first memory clinic. So we're aiming to roll out a large memory clinic for the local region, which will be accessible to all Australians, which will deliver an integrated healthcare model where Australians have a chance to get a diagnosis of dementia and the appropriate follow-up and linking in with education that they require. And I'll leave you with the last comment from Professor Rockwood, the most well-known geriatrician in the world. And he said that if you set up services to deal with single problems in people, and then the people turn up with multiple things wrong at once, then the problem is not with the service, it's not with the problem with the people, it's with the service. And what we're trying to do is to try and set up a service that delivers the care to the people that we're trying to serve. Thank you.
Very much, Mark. And a question from Jill.
Thank you, Mark. As someone who's got ageing parents, I completely can relate to what you've presented. My question is about the support for or with the extended families, and particularly the need for those extended families to have online access and the like. So how do you go about integrating the needs of the various generations in a project like this?
That's a lovely question, and you're quite right. You point out online, but not everybody is digitally literate, as it were. So we're working with the councils to deliver that, for example. And as an example is leaflets, and we have leaflets for the community geriatric service that's given out to people, so they have the hard copies of that. The PHN as well are developing something called a Health Pathways project, which is both online, so it explains to people with aged care related problems where they can go to access appropriate services, education, etc. At the moment, that's all been quite fragmented. Alzheimer's Australia, for example, to have some wonderful resources, but you can only access the resources if you know that, and if the doctor tells you, the nurse tells you, for example. So with the groups that we're working with, and that integrated approach brings together all of this to the benefit of the patients. They have access to information that they require in a timely manner.